Dr. Berg, I'm here to ask you 20 questions about yourself and Atlas Chiropractic today.
Sounds good. Why don't you come on in?
Thank you.
You're welcome.
Lead the way.
Okay.
So tell me, what made you go into chiropractic?
Years ago, I was the son of a medical doctor, and to be quite honest, I didn't have the stomach for medicine, the kind of the blood and guts of it all. So I wanted to help people in the way that I could without the gory side of it, and it's really turned out to be a good fit, me and chiropractic. So yeah, love being a chiropractor.
And how did you end up choosing Spring Lake Park for the location of your office?
I've been in a number of locations over the years, but many years ago I met my wife, who's a Blaine native, and she actually went to school over here at Spring Lake Park, and in a roundabout way, you know, knowing her and having her come into my life, it drew me into this area, and I relocated from my Bloomington office to Spring Lake Park, and I've been here ever since.
Awesome. You have a lovely office, by the way.
Well, thank you. That's our Traeger grill that we're giving away. We have a Make a Difference promotion going on right now, and some lucky winner's gonna get that, and you know, a number of the ways that our patients are able to be in the drawing, but we're gonna be giving that here to some lucky patient here in the near future. And we're having our mantle built, and we're gonna have stonework put in on the inside. It's still in process right now, but it's all coming together. But yeah, this is our waiting room. Right over here to the side, that's our conference room. Sometimes big families will come in and they'll have a seat there while they're waiting for their folks to get checked or whatnot. So it serves a lot of different purposes though.
Lovely. Mind giving me a tour of the rest of the office?
Yeah, come on, follow me. So right over here is our hand washing station. With the whole COVID-19 thing going on right now, we're requiring all our patients wash their hands. So it's pretty handy that we had that station already here beforehand. So it's been extra useful with the circumstances that we have right now.
Awesome. So Dr. Berg, you specialize in a special care of chiropractic, right?
I do.
Mind telling me a little bit more about it?
Sure. Want to come on in here? The work that I do is called Atlas Orthogonal Chiropractic, and it differs a lot from mainstream chiropractic due to the focus on that upper cervical spine. The Atlas is the top bone right at the base of the skull, and it wraps around the lower brainstem. So when we're working on people, we're truly trying to clear brainstem dysfunction, and then we can work on other areas besides the Atlas, but that's our initial goal, is to clear that brainstem. This poster over here, I think, does a pretty good job of showing a little bit of the bigger picture of how the brainstem works, but the area right up here where the Atlas is has a lot of neurological function that controls and coordinates many parts of the body. A lot of people come in thinking that they're having aches and pains, but what happens is they find out that other things start working better under the care because we get this area of the neurology firing up at a higher level, and just areas of the body start to improve because of it.
Awesome.
Yeah. Follow me.
So what kind of conditions do you see and treat here?
We see and treat lots of different conditions, and kind of ties back into that post I was just showing you with the brainstem. But here's another post that we actually use to educate our patients. And I don't want to say that this is a complete poster of everything that we do, but it's common stuff that walks into our office and is treated here. And you'll notice things on there like allergies, ADHD, chronic infections, digestive issues, headaches, allergies, high blood pressure, low back pain, you know, restless legs, just a whole myriad of symptoms. And it really is, we're able to help those things due to the fact that that central nervous system via the brainstem is working at a higher level with our care.
Wow, I had no idea you could treat all of those things.
I didn't either until I learned it in school.
That makes both of us then. And what is this room here used for?
This is our consultation room, and when a patient comes in for the first time, we sit down at this table. I'm sitting right here and they're on your end, and we just sit down and have a conversation and talk a little bit about what's going on, what brought them here, and we just want to have a nice, quiet, you know, clean, safe environment that they can open up and let us know what's happening, so we can hopefully start to get down to the bottom of what's going on with their condition.
Cool. And over here, it looks like, is this a picture of you and your wife?
It is. That was taken on our wedding. I've been married for 12 years to Selena, and we have 2 boys, Conrad and Corbin. So a busy family life.
Awesome. And wow, look at all these degrees on the wall. Where did you go to chiropractic school, Dr. Berg?
I went to school at Palmer College of Chiropractic. So this is my degree right here. Dr. Haney, we have another doctor in the office, and he's got some of his stuff up there. But nonetheless, Palmer College is where chiropractic was started. D.D. Palmer, back in 1895, invented the concept of chiropractic, and myself and Dr. Haney actually both went to school at Palmer College down in Davenport, Iowa, and I graduated from there in 1996.
That's awesome. All right, where to next?
Follow me. Come on in here. Come on in. This is our therapy room. And what we have is a few different therapies here that are just designed to aid the patient in the healing process. The mat right here, what it does is it kind of sends in an electrical impulse into the body that helps regenerate and recharge the cells so that the cells have more power to go about the healing process that they're trying to do. Over here, we've got a vibrational plate. This is really good for helping people with mobility issues, flexibility, strength. Vibration is pretty versatile. You can do quite a bit of stuff on it, and it just basically vibrates while you're doing exercises or stretches. Over here, we have it's basically a fancy massage chair. It can also do intersegmental traction, which helps stretch the body some, but it has a lot of rollers and heaters in it designed to loosen up tissue. And probably the last thing that we use quite a bit over here is also called our laser. Laser does the same thing kind of as what I was talking about with this mat. It just sends energy into the body, which helps the cells do more regeneration with that extra energy. Helps in the aid of healing.
Awesome.
Yeah, follow me.
So I keep seeing these chairs down the hallway. What are they used for?
We got a lot of them. These are like on deck chairs where somebody would sit and wait outside of a treatment room because they're the next person that's going to be seen in the room. We've spaced them out more due to the social distancing that's going on because of COVID. Normally they're a little bit tighter in and so people can chat with each other or family members are together. But like I said, we push that apart due to the social distancing.
Nice.
Yeah.
Are you the only doctor that works here?
No, we got Dr. Haney. Dr. Haney has been with us for, I believe, 7 years in this office. He graduated a little bit longer than that and spent some time down in South Carolina, but he's been with us in this location for 7 years, and he also specializes in the same Atlas work that I do. So he and I work very well together, and this is one of his treatment rooms. And then he's got another room pretty much just like it.
Nice.
So he works out of these two. We can head on into one of my treatment rooms.
So, Dr. Berg, how many years have you been in practice then?
Oh, wow. I graduated from chiropractic school in 1996, and I've been in practice for myself with the business Atlas Chiropractic for 22 years.
Wow. Did you know that's longer than I've been alive?
I can believe that. It actually pains me to hear you say that, but yes, I can believe that.
Well, Dr. Berg, I do trust you with my life, so. All right. And what is this machine here?
This is the instrument that we use that really sets us apart from most other chiropractors. This is called an Atlas orthogonal instrument. And if you stay close in like that, you'll notice a little hammer is going to come down on the inside of there. That hammer is coming down and hitting the backside of what we call the stylus with 4 pounds of force. So it generates a 4-pound vibrational force. This does not move at all, but if it's touching the skin, that vibration will vibrate into the body and move the vertebrae, the atlas, in the manner that we have desired, based off of the films and everything else that we've done. So this is kind of really what sets Dr. Haney and myself apart.
Wow, that's crazy.
And then we have another table over here, kind of right behind you. This is called a Thompson drop table. I hope that this isn't going to be too loud when we do it, but we activate it. Oh, it's already been activated up. Patient's laying on here, and we can do a little bit of pressure on the patient, and the table drops down. And at the moment that table bottoms out, it causes slight motions to happen, inside the anatomy. So these are ways to adjust the spine and extremities and things like that in a manner that's very gentle and safe for the patient.
Nice.
Yeah. Everything we do, we try to do, our motto here is basically safe, gentle, and effective. That's what we want.
Have you practiced anywhere else besides this office?
I sure have. I spent some time down in Augusta, Georgia. That's where I first got started. And then I worked a little bit down in Atlanta, Georgia, and then I came up to the Twin Cities. Started off my career in the Twin Cities in Oakdale. Moved from Oakdale to Rosemount to South Minneapolis, and then from Minneapolis I came up here. So I've been in a number of locations over the years. But I've been here in this location since 2009.
Wow. So how many patients do you think you've seen over the years?
Wow, that's a good question. Due to the fact that I've been in so many different office locations over the years, I'm not exactly sure, but it's definitely in the thousands. But I couldn't give you a hard number on that.
Wow, that's impressive.
Thank you. I don't know what else I can show you in here. Oh, one more tool. Once again, it's another tool that's used to design the spine, used to adjust the spine, and we can just use a slight bit of pressure, and that can help move vertebrae or stimulate muscles. It's called impulse instrument.
Awesome.
Follow me. We'll go in here.
And what is this room used for? It looks different.
Yeah, it's not a treatment room. This is the office administrator's room, and the office administrator will do a lot of behind-the-scenes work to keep the office up and running and being smooth and working the way we want it to. Staff will bring in patients here and talk about financials or insurance questions that they may have. Once again, just a nice, quiet environment to be able to discuss the things that you wouldn't probably want to have discussions with out in the waiting room area.
Awesome.
Yeah.
Okay. Well, it looks like we're making our way back to the front again.
We've gone a full circle here.
Yes, but I do have one last question for you.
Yeah, what's that?
What is the best part of your job?
Really what that comes down to is working with patients and seeing them get better. I've been doing this for, like I said, 22 years in my own office, Atlas Chiropractic, and the joy really comes from seeing those patients that come in really banged up, struggling with their health, and just watching them get better. It's kind of what keeps me charged up in doing what I do.
That's awesome, Dr. Berg.
Yeah, thanks for the question.
You're welcome. Thank you for having me.
And we have gone full circle now.
Yes.
Well, it's been wonderful having you here. I'm glad that you were able to take a little bit of time out of your busy schedule and come and visit us at the office.
Absolutely. Well, thank you so much for having me.
You're welcome.
You have a good day now.
You too.